Hello everyone, my name is Kelsey Langdale and I am a DNP candidate for Jacksonville State University School of Health Professions and Wellness. Today I am presenting my DNP project on the development of a postpartum depression screening protocol in the neonatal intensive care unit. During this journey, my preceptor was Molly Desai and my project chair was Dr. Sharon DeWeese. Postpartum depression is considered the most common complication of childbirth. It affects the entire family unit, and these effects extend well into adulthood. Postpartum depression affects approximately 19% of all postpartum women. However, postpartum depression is grossly undiagnosed and underreported, so prevalence is much higher. There is an increased risk of postpartum depression in mothers of hospitalized infants. These estimates range from 28% to 67%. Of these women actually having postpartum depression. However, this population is even more undiagnosed and underserved, so prevalence is much higher. The American Academy of Pediatrics and Bright Futures recommend mothers be screened for postpartum depression at the Infants Well Child appointments. These appointments occur at 1 month, 2 month, 4 month, 6 month, and 12 months. During hospitalization, there are no well child appointments, thus no postpartum depression screening. There are no recommendations for postpartum depression screening in mothers of hospitalized infants, despite these mothers being at much higher risk for developing postpartum depression. Without these screenings, this is a missed population and a missed opportunity to decrease adverse childhood outcomes. The learning outcomes of my projects was to improve knowledge of postpartum depression in the staff of the neonatal intensive care unit and to investigate the NICU staff's interest levels in implementing a postpartum depression screening protocol. In staff of the neonatal intensive care unit will development of an evidence-based educational presentation focused on screening mothers of infants in the NICU compared with no evidence-based educational presentation, improve knowledge of postpartum depression and interest in postpartum depression screening. The theoretical framework I used to guide my project was the humanistic nursing theory. This theory was developed by Josephine Patterson and Loretta Zatarad. These two believe that a nurse's training should focus as much on the nurse's ability to relate to and interact with the patients as a scientific and medical background. This approach to nursing places emphasis on the nurse-patient relationship, in which both parties influence the outcome of nursing interventions. This model shows that the relationship between the nurse and the patient has as much to do with the patient's healing as medical interventions. During this process, I conducted a literature review. I searched many prestigious databases and extracted 6 articles that I used, the first one being from Yogman. The purpose of his study was to evaluate rates of postpartum depression screening by pediatricians in Massachusetts in 2013. He compared these rates with rates obtained in 2004, and it did show an improvement. However, it was still only 44%. Also, when Massachusetts released its recommendations in 2016, it did not include any postpartum depression screening. So he used his data to make recommendations that Massachusetts include routine postpartum depression screening in the pediatric primary care setting. Another study was by Cherry and Associates, and the aims of this project was to describe the development of postpartum depression screening program for the NICU, similar to what I wanted to do. He showed that after implementing the postpartum depression screening, approximately 36% of mothers had a positive screen that resulted in a mental health referral. The next study was by Trost and Associates. The aims of this project was to assess for postpartum depression at infant hospitalization and examine depression risk factors in this population. So 87 mothers were EPDS positive, and only 14% of those mothers had reported a prior depression screening. Additionally, this study showed that low social support, past psychiatric diagnoses, or having infants with neurodevelopmental problems may increase the risk for postpartum depression. The next was by Hall and Associates. The purpose of this study was to propose directions for future research with the aim of increasing access to services. This study highlights the ways in which best practices for postpartum depression interventions with the NICU parents may fail to reach low socioeconomic status and low socioeconomic status ethnic minority mothers due to barriers to care. So this study was interesting and showed that mothers of low SES experience high rates of preterm birth in the United States, and a mother's diagnosis of postpartum depression qualifies as an adverse childhood experience and has been shown to negatively impact multiple aspects of children's mental and physical health across the lifespan. This study showed that interventions for NICU parents that successfully target depressive symptoms and privileged maternal presence on the unit may therefore neglect low SES mothers who often face significant barriers to visiting the hospital. The next one was a study by Varma and Associates. The purpose of their study was to determine the level and sources of stress in mothers of infants admitted to the NICU. So this study showed that higher maternal stress was found to be associated with poor family support during pregnancy, mother's perception of baby's discomfort, extremely low birth weight of the baby being on the ventilator, postpartum depression, and moderate to severe anxiety symptoms. So remediation programs for parents should be designed keeping in mind the local demographics and the predominant stressors that should always have a component that addresses parental role alteration. The possibility of screening at-risk mothers by questioning them about the perception of baby's discomfort needs to be evaluated further. And finally, a study by Seward and Associates evaluated the feasibility and acceptability of evidence-based nurse-delivered on-site depression treatment listening visits. This was really interesting. It's already used in the United Kingdom. Clinically significant symptoms of depression and anxiety are prevalent in mothers of hospitalized infants, which we know. Because these symptoms of depression are prevalent in mothers, it is very important that we have an intervention that can be delivered early in the NICU. So listening visits are a promising first-line approach for treating distress in mothers of hospitalized infants. This preliminary evaluation demonstrates that it is feasible and acceptable to use listening visits in the NICU and demonstrated that the mothers felt improvement in both their mood and quality of life. So this project was a quality improvement project that was aimed at increasing the NICU staff's knowledge of postpartum depression presentation, identification, its effects on childhood development, available resources for mothers with postpartum depression, and interest in implementing a standardized postpartum depression screening protocol. The goal is to measure staff's knowledge of postpartum depression and interest in implementing a postpartum depression screening protocol. The Plan, Do, Study, Act model for quality improvement implementation was an effective model to facilitate these evidence-based recommendations into practice. So this DNP candidate met with the CNO, presented the identified problem and solution, and obtained permission to begin the process. Next, I began corresponding with the NICU nursing director and the neonatologist for suggestions and input on the project, and I developed a postpartum depression screening protocol. Next, I provided educational presentation at multiple times convenient for both day shift and night shift for their employees to attend. I then analyzed the survey results to evaluate the effectiveness of education on knowledge and willingness to screen for postpartum depression. And then I presented these findings for future change in practice and intervention. The outcomes of my study. So a Welch 2-sample t-test was completed to analyze pre-education and post-education surveys of 31 participants. The mean score for questions that gauged knowledge pre-intervention was 12.548, a minimum score of 5 and a maximum score of 25. After the educational presentation, the post-intervention mean was 21.839, indicative with 95% confidence that the 30-minute evidence-based educational presentation improved knowledge of postpartum depression by around 74%. On average, implementation of this educational presentation could increase knowledge a minimum of 7.597 and a maximum of 10.984 points, utilizing the same Likert-style survey. For willingness to screen, a Welch 2-sample t-test was completed to analyze pre-education and post-education surveys of 31 participants. For survey questions 3 and 4, the mean pre-intervention score was 5.323 with a minimum score of 2 and a maximum score of 10. After completion of the educational presentation, the post-interventional mean was 8.742, indicative with 95% confidence that the provided educational presentation increased staff willingness to screen by around 64%. So on average, implementation of this educational-based presentation could increase willingness to screen by a minimum of 2.655 and maximum of 4.184 points using the same Likert-style survey. In conclusion, as a result of this QI project, there is an increased awareness of the need for postpartum depression screening in the NICU. The results of this DNP project provide an opportunity to collaborate with leaders and implement an appropriate, evidence-based postpartum depression screening protocol in the NICU. As a result of this project, the facility has an increased awareness of the need for the postpartum depression screening in the NICU to align with its mission to provide the finest pediatric health services to all children in an environment that fosters excellence in research and medical education, and to serve and advocate for all children and work to educate the public about issues affecting children's health and well-being. This DNP project provided an opportunity to collaborate with leaders to implement an appropriate, evidence-based postpartum depression screening protocol in the NICU. I would like to thank Jacksonville State University for providing me with a prestigious education, for the College of Health Professions and Wellness for giving me all the resources I need to succeed, Dr. Sharon DeWeese for her kindness and patience throughout this entire process, my many family and friends who have supported and encouraged me throughout my life, education, and career, my husband Justin for being nothing but loving and kind and filling in the gaps when I needed him to, for my sweet daughters, Maddie and Parky, for reminding me there is always time to play Barbies and cuddle, my many co-workers who supported and encouraged me throughout this completion, my dad who continues to inspire me. This project is also dedicated to the many mothers who have an invisible mental illness. You are not alone. Here are the references from my project and my research. I thank you all for your time, and I hope you enjoyed my presentation.